Welcome back. Mount Sinai's Health System Center for Excellence in Youth Education makes an effort to introduce more kids to the world of science and healthcare. The CEYE aims to connect with youth from underrepresented communities, offering a range of school year and summer programs. Here to tell us more about their effort is the program director for the CEYE, Kenya Townsend. Kenya, thank you so much for joining me.
Sure. Thank you so much for having me. Excited to be here.
Now, can you first just tell me a little bit more about the overall mission of the Center for Excellence in Youth Education at Mount Sinai?
Absolutely. So we were established in 1975, really with the effort to really introduce students that are underrepresented in science and medicine to careers that are in science and medicine. And so CEYE is one of the divisions within the Office of Diversity and Inclusion. And so we work with the cross section of public schools, colleges, as well as youth organizations to prepare students for those careers. And we're really excited to continue to do that work as we've been doing for the last almost 5 decades.
Now, can you talk about some of the different programs designed to introduce students to science and healthcare, which I think is just so amazing. I think that it really shows how much we're just kind of like moving forward in society. Because I think even maybe 10, 15 years ago, or, like a while ago, I couldn't even imagine like young students really like working in science and healthcare. So
Yeah.
Can you just talk about those different programs?
Absolutely. So we serve over 300 students each year, and that's a combination of academic year programs as well as summer courses. And so we really, our portfolio is longstanding. It's a pathway. So we serve grades 7th all the way through college. And so some of those programs, I'll go into it a little bit. At the academic year programs are programs that actually take place from September through June of the academic year. And so we start at 7th grade. We have a Minds program for 7th graders that are learning about neuroscience, which is really cool. We also have 2 8th grade programs. One is Day with the Scientists. So we bring a group of students over to Mount Sinai's campus real time in the same classrooms that the medical students take their classes in. And so they're putting on lab coats, they're dissecting organs, and that's really exciting to do with the local community. In addition to that, we have a BioEyes program, which students learn about science, but they do it through zebrafish. And so that's incorporated into the standards that they need to learn for 8th grade. And so that's the junior high school level. At the high school level, which is really our sweet spot, we do a lot of program there as well. We have academic year programs, really 2 programs that are in partnership with 2 high schools in Manhattan. One is called the Biomedical Science Enrichment Program, and that's in partnership with the High School for Science, Math, and Engineering. And so that program is very similar to the second program mission, but they come over as 11th grade students, and they take classes at Mount Sinai's campuses for the morning session. It's on their transcript, so it's really great. They get basically intro-level college course level work.
So cool.
Absolutely.
I think I also want to talk about the fact that it starts at 7th grade, which is that's just amazing. Why did you want to start so young? Because I think around 7th grade, it's 11, 12-year-olds. And they're learning this stuff that, like you mentioned, people don't really even learn until they get to college. So, why did you want to start so early?
Yeah. So 7th grade was really important in general because we work really closely with New York State Education Department. And that is really where they are mandated to have science units. And so we felt like in partnership with that would make sense to start at the 7th grade level. Obviously, digging deeper into the pipeline is important as well. But 7th grade, they can really understand some of the concept of neuroscience and organ systems too.
Now, I also noticed that just over the past several years, there's been an effort to encourage more children and even young adults to pursue careers and hobbies in STEM. Why do you think we're seeing this shift? And I'm happy that we're seeing it because I mentioned, even when I was young, I don't think that I had these types of opportunities available. So, why do you think we're seeing that shift?
Yeah. So, collectively, Black, Hispanic, American, Indians, and Native Alaskans make up 31% of the population, but only 24% of the careers in STEM. And usually those careers are those that require technical skills and really certifications rather than a bachelor's degree or higher education. And so it's been a concerted effort across the board from a lot of organizations like CEYE, right, to make sure we increase that. So in the next 10 to 15 years, we can see these young people at the face of medicine and science.
Now, I also want to talk about that because I think it's so important. Recently, we've been in in the healthcare system, we've been talking about race, and
Mhm.
how that's been impacting a lot of the patients. How do you think having these children be involved in this is going to impact the future, of the healthcare system, especially for people of color?
Yeah, yeah, absolutely. So, I mean, one, it doesn't hurt that we are in New York City, which is one of the most diverse places, I think, in the world. And so, being at Mount Sinai, which is a really large health system in the city, I think having young people be introduced and work with faculty, right, that have studied and are doing that, they really see themselves. And so that is one of our underlying missions, is for students to be able to see themselves as scientists. And so if they can do that, then they see themselves in health career, and now we can change the scope of diversity, right, in the future. So,
Now, also talking about diversity, I think that, like, of course, like, race is important, but also, like, your income and, like, the family that you come from.
mhm.
I know that anything with medicine and science tends to often, or maybe there's this misconception that it's just like super expensive and that you have to have money to, kind of learn these things.
Right.
Can you talk just a little bit more about that?
Yeah, absolutely. So, I mean, again, while we definitely service students that are underrepresented in medicine, we also do look at students that are economically disadvantaged. And so it can be, depending on what you want to do in higher education, costly to sort of do that. And so by offering our programs free of charge, right, we also sometimes pay some of our students that are in our
Oh,
programs.
wow.
We lighten the load and at least have them hold on to the idea and the possibility that they too can do it. And so, it's important to know that, but not to be discouraged around what you want to do, right? Anything that you want in life really is gonna take some hard work. And so we want to be a support system along with our other colleagues that are doing this work that can continue to push you forward.
So you mentioned that sometimes you even pay students. I think any student listening to that is like, that sounds good. Can you just talk about some of the incentives that come with joining these types of programs?
Yeah, absolutely. So we have summer programs that are open. So we work in partnerships, but also any students that are interested that live in the Bronx, anywhere in New York City, they can apply to our summer program. So the application is currently closed for this summer, but in the future, we're happy to come back to talk to some more about it. But those students that are accepted to the program, they do get Metro cards. We do give them a stipend, right? They get to get a lab coat, they get an ID. So I mean, they are really excited to be on campus. And really, while the funds is really nice, really it's the idea of being around this and the possibility that we at CEYE really feel is the bigger prize. But obviously we want to make sure that that isn't a barrier and they're selecting working other than actually doing some sort of research or experience in a hospital.
That is also very true because I know that sometimes, like, there could be opportunities available, but if you're like, I have to help support my family,
Right.
sometimes kids are going to just choose the option
Absolutely.
that's going to help support their family. So thank you so much for mentioning that.
Yeah.
Now, as mentioned before, the program begins in seventh grade. Is there an opportunity to kind of like grow within the program? So maybe you started at seventh grade and then now you're an 11th grader and you're still in the program. Can you talk a little bit more about
Absolutely,
that?
absolutely. So, I mean, the goal, right? We have a portfolio programming from seventh all the way through college, and the goal is to have students from seventh grade all the way through college, right? And then actually become what they would like to be in that field. And so, we have partner programs. We drill down into them to make sure they know when they get to high school, right? This is the high school that we have partnerships with. Also, if you're just in any high school, right, throughout New York City, please apply to our programs. They're open to ninth through 11th grade students. And so we keep little nodes on all of them to make sure that they actually are still applying to our programs and get to stay in. And we have quite a few that have matriculated even into the medical school.
Now, I think this is a really amazing program. I kind of wish I had something like this, when I was in middle school. But this sounds so amazing. What are the requirements, though, for applying to this type of
Yeah,
program?
yeah. So for our summer programs that are open for any New York City students, you do need to be part of any of the underrepresented groups that I mentioned a little earlier. You do need to go to a public school, right? And really, we have application and do essays. It's a very competitive program. I won't say that it isn't, but I think that if you have the goals to really do it, this is worth applying to because we become a family and you never really get rid of us.
That's awesome. That's so amazing. And then can you just talk a little bit? I'm not sure if you work closely with the students, but can you just talk? Well, since you do, can you talk a little bit, about how that has been for you, like
Yeah.
seeing some of these kids from these communities kind of grow in this program?
Yeah, absolutely. So, I mean, I am one of the kids from the community, right? I was pre-med. I didn't have this opportunity when I was younger,
Right.
but I learned about it in college and a little later. And so it brings me such joy to be able to see the students really think about this idea, right? And some of the skills that you're learning on the way from a seventh grader or a high schooler to be in STEM are really transferable to wherever you go. Luckily, we do have great students that continue on into STEM. I mean, we have a really high rate of college graduates that go on and study science. So, I mean, it's really exciting for the team and I to really see the students develop, right, at this like critical point in their life and really decide they want to go major in neuroscience or they want to go be a doctor and then come back for the college program or matriculate and apply and ask for a letter of recommendation into the medical school. So yeah, I can't even, it's not a tangible way that I can really say that, but I really enjoy it.
Now, seeing like from your own experience to seeing these kids, what do you hope is the next step for the future of, children in, just from underrepresented communities in healthcare? Like, what do you hope to see as the next step? And what are some ways that we can make that even better for these kids?
Yeah, so I mean, I think the hope and the next step is one to continue to move forward. This doesn't become a barrier for us. This is just very normal, right? And so that percentage gets to grow, that they're coming back and giving back. We do teach that as well. So if they're a physician or if they're a scientist, they are also giving back in their communities, whether it's going to be in New York City or someplace else. And we just want to continue to push the idea of diversity and to now lower the bar some for students to be able to get in where this is just like as normal as wanting to be a teacher or entertainer. That would be the goal.
Right. And I also think it's important that like this is such an amazing opportunity, but hopefully like, it's not just for like certain kids, but like literally like it's just a norm in a lot of public schools that you have this type of education. But I want to thank you so much for joining us and having this discussion. I'm already inspired, even though I'm not, in seventh grade. I was inspired by this. So I truly appreciate you taking the time to talk to us.
Thank you so much for having me.
To find out more about CEYE summer programs, please go to their website, which you can find on the screen below. We have to take a quick break, but we'll be back with more open right after this.